Okay, continuing on the pharmacology course, this is a real quick lesson, and we're still in the IVIO unit. We're going to talk about IV starts. And while that takes a little bit of time to learn in the lab setting, there isn't a great deal to talk about in this setting, so we're going to move through it pretty quickly. We have a checklist that you need to learn. You need to learn the checklist in order and do it the same way every time. And the idea will be that you're using very little brain to worry about the steps, that you're able to think about other things, that this becomes almost completely a motor skill. And so we need to get the steps down. We'll practice them over and over and over until we get them down. The actual sticking of the IV, you just need lots of practice with that, and that practice comes best once you're in the clinical environment. But there's no reason to subject someone to a stick until you have your sequence down. So we will verify that you have your hands in the right place and they're doing the right things, and they're doing it in an expeditious, reasonably quick manner, and then we'll let you start sticking things, and eventually we'll let you start sticking unsuspecting patients that are in ERs that are allowing you, whether they know it or not, to hone your skills a little bit there. So as far as IV starts go, we look at peripheral veins as opposed to central lines. We don't do any central line teaching in our program. So a peripheral vein would be anything in the arms, legs, up to and including the external jugular veins. We don't do central lines. That would be an internal jug or a subclavian. Very, very few services do those anymore. But peripheral veins is what we're into. We'll talk about aseptic technique over and over and over and over. The idea is that we should not be introducing any additional infection risks to our patients. We'll talk about site choice and how you decide where to start your IV, and that's usually based on how sick the patient is and what sort of choices you get. If you start at the AC space, at the elbow more or less, if you start with the AC, then there really isn't any option for you to go distal to that. But think about a patient that's going to be admitted to the hospital and be in there for several days, if not weeks, and they're going to need to have that IV changed out. In fact, a lot of hospitals consider that we in the field are dirty people and can't start aseptic lines, and they'll change out our IVs just because it was started in the field. So if we've already gone to a proximal site, then anything distal to that is pretty much not available, and we might decide that our patient is not particularly unstable, not horribly sick, and so we might spend a little more time and go a little further distally and then help that patient throughout the course of their hospital stay. On the other hand, if this patient's way sick, we need to get the line way quick. And so your site choice is really impacted by your patient condition. Just think about doing the most distal site that you can get reasonably and practically. The sequence, and we have a checklist that's also provided in this Moodle course, and we'll go over it and over it and over it. And like I said earlier, it's got to be something where it becomes a motor skill. And we'll talk about tourniquet application, and we'll have you start beginning to find good veins. I think you'll find that you have a finger that will become expert at finding veins because it's really feel more than it is sight. You should be able to close your eyes and find a vein. We like you to keep them open to add that additional sense to it, but in a lot of cases where you can't really see anything, you ought to be able to feel something, and we teach you to find the difference between a vein and other things that you don't want to poke. And then we'll teach you how to clean it and then mark that with your alcohol pad. You kind of use your alcohol pad as a pointer so that you know where you're supposed to go and you don't have to go back in and touch it again after you've cleaned it. We'll teach you to insert the IV catheter with the needle inside, get into the vein, get the flash of blood that comes back in the IV flash chamber, and then how to thread it, pull that needle out, connect everything, and release your tourniquet, and we'll go over and over and over that. And it'll happen to you in simulation lab. It'll happen to you for real, possibly. Hopefully we'll get this worked out of you in sim lab. But you start the IV and you don't release the tourniquet, and then the IV doesn't flow, and you spend a bunch of time messing around with the IV trying to get it to flow when all you had to do was release the tourniquet. So that release the tourniquet's a key step, and that's where this work on sequence makes a huge difference. Then we'll set the rate. Going to talk about that briefly here and then a whole lot more later, and you tie everything down. So it's really not difficult in terms of the number of steps. The steps should be in a logical order. You should do them the same way every time. And it's important that you then remember just a couple of things. And we'll talk about setting the rate here real quick. Now, this is quick and dirty. And so we're basically going to look at 3 rates right now. We're going to look at TKO, which means to keep open. I didn't invent these, I'm just teaching them. TKO, to keep open. Some places also use the term KVO, keep the vein open. Either way, whatever you want, it's a TKO, and that is dripping very slowly, and there's enough fluid running in, just enough, a very small amount, but just enough to keep the clot from forming in the IV catheter. It's just to keep that vein open. We're not trying to give any fluid through here. We're just trying to have it available if we need to give medications. The other one's pretty obvious. That's wide open. That's when the roller clamp is totally released and that fluid is flowing as fast as it can flow. And that rate can vary depending on the size of catheter and a number of things in terms of the bag and the set and how high it is above the patient and probably barometric pressure and potentially the moon phase and I don't know what all. But it's wide open. It's as fast as it will go. So TKO is as slow as you can have it without a clot forming, and then there's wide open, the other extreme. And we think there's a happy medium there. So we talk about a drop every other second, 30 drops a minute, more or less. That'll get you around 100, 150 cc's an hour, something like that. And we'll talk about how to figure all that out. But for now, if you're practicing sequence, when it says set the rate, just set it at KVO, or set it at wide open, or set it at a drop every other second or so. Basically, we have slow, really fast, and kind of medium. And that's the way we're going to deal with rates for now.